Good day. I am Dr. Wilfredo S. Tagle, urologist, and welcome to Medical PracTIPS, a series of tips and tricks to help you jumpstart your medical practice. For today's episode, we will be talking about the medical ethics on educational grants. Okay? From the general principle in the Code of Ethics of the Philippine Medical Association, it is the primary objective of the practice of medicine to serve mankind, irrespective of age, race, disease, disability, gender, sexual orientation, social standing, creed, or political affiliation. So you have to serve everybody. Medical practice is rewarding, or financial gain should be a subordinate consideration of your practice. According to Article 2, for the duties of physicians to their patients, Section 1 says that a physician should be dedicated to provide competent medical care with full professional skill in accordance with the current standards of care, compassion, independence, and respect for human dignity. That means you really have to care about your patient or for your patients using your medical skills, irrespective of whatever affiliation your patient would be. Then, in Article 4, the duties of physicians to their colleagues and to the profession, Section 10 says, continuing medical education, conference, and professional meetings must contribute to improve and optimize patients' care or address the educational needs of the targeted medical audience. They must be organized by a medical society or organization on its own or in cooperation with sponsoring entities. So it should be done and organized by your own medical organization. In relation to this, the physician should update themselves regularly by continuing medical education. So year in, year out, you have to continue your medical education. But the cost of pursuing continuing medical education is prohibitively expensive. There was a study that for a doctor coming from the province, going to Metro Manila just to attend a CME program would cost them a lot of thousands of pesos, especially for physicians practicing in far-flung areas of our country. In line with this, Section 12 says that physicians may accept reasonable subsidies from health and other industries to support their participation in CME events. Especially, we cannot avoid but look for other sources like educational grants and financial aids to update our skills and knowledge in the fast trends of medical practice, especially these days that there is a very fast changing and updates of technologies. So, educational grants are financial support given by funding agencies from the government, could be from NGOs, could be from private entities, or from philanthropic individuals. These are given to promote and uplift the medical services in our country or anywhere in the world within a given period of time. So you can ask educational grants or financial support from a lot of funding agencies. On the other hand, there is also financial assistance. Financial assistance are given to individuals with immediate and severe need for medical knowledge or skills in a given community at a particular time. This happens during the COVID-19 pandemic. So there's an immediate need to know what would happen at what treatment shall we do for that immediate particular time. Then, remember that grants received to finance continuing medical education activities should not influence your judgment to favor treatment and method of care that would be advantageous to your granting agency. There should be no tie-up or given accommodation. It should be clear and specific from the very beginning or before the financial grants are given. So, that's it for today. Like, follow, and subscribe to our Facebook and YouTube page to catch the latest episode of Medical PracTIPS every Wednesday at 7 p.m. Please share this episode of Medical PracTIPS so we can help more aspiring doctors build their practice and better serve their patients. See you. Bye-bye.